Trinidad context, is it that the first step of the procedure is done in Trinidad and
Right.
then it's continued in the Barbados? Could you tell me a little bit about that?
Sure. So what we do is that you do have your initial consultation actually with the nurse here in Trinidad, and that consultation is free. And so what she does is she will go through your past history, yourself and your partner if you have one, and then from there we go ahead and we set up a scheduled meeting with Dr. Skinner over the telephone. So that's also very scheduled. We do respect our patients' time. We respect that. That's important to them, so we get a mutually convenient time for both parties, and then from there we also do the diagnostic testing. So all the diagnostic testing is done here in Trinidad. If the patient wants, they obviously have the option to come to Barbados, but they can certainly have it done here. And then what we then basically start them then on the protocols that are specific to them.
So how long, if a patient is in Barbados and is in Trinidad, going to Barbados, how long are they going to be away from work?
Right, they're going to be away for 7 days. And within those 7 days, then they come up, they obviously meet the team in Barbados, and it's very continuous care. We are in Barbados supporting the Trinidad team. So when they come to Barbados, we aren't foreign names and we aren't foreign people. We've been speaking to the patients in Trinidad already. And they go ahead and we have the egg collection that's done in Barbados, the embryo transfer that's done in Barbados, and then they come back home, usually pregnant. So, and the reason that we ask patients to come to Barbados is that one of the biggest and most important parts of IVF is the laboratory. And we have invested a huge amount of money to make sure that our lab is to the highest of patient care. And going back to the same JCI, you just have the most top-notch world-class facility when you're looking at our lab. I mean, the air is 99.999999% clean. You know, all of our technology, all of our we do assisted laser hatching, we do vitrification, we do PGD in that lab, and these are all cutting edge and all very first world.
So much positive things, the stress-free environment that you create, the GCI seal of approval, the standards of excellence and world-class practice. I wanted to get to the point of just the misconception, I don't know if that's the correct word, that the issue is IVF. And where does that come from, and what other services are offered?
Sure. Well, it is a misconception that everyone, when they are seeking out infertility treatment, that you have to jump to IVF. That is not the case. The biggest factor, I guess, that we need to be conscious of is the woman's age. And as women too, we need to watch that clock. That's a factor of our lives. We are born with all of our eggs, unlike men who produce sperm throughout their lives. We women are born with all of our gametes, as they're called. So as we continue to age, the quality of those eggs begins to reduce. So that's the part that we have to be conscious of. When you do have that investigation and those investigations start, it's very interesting that many women think that it's them. They have the problem. I am not getting pregnant, so it must be me. And what we realize is that it's not always the woman. It's also the man that may have a problem. In the cases where it is a male factor, it's actually easier to treat than is a female problem, because we can get so specific in our lab that we can actually select one single sperm to inject into one egg. So you can get as specific as getting the biopsy needle onto that one single sperm.
Wow.
So, yeah.
So it starts from there.
It does. Well, I think too, once that consultation is done, and we take your medical history, then we can go ahead and we can say, okay, guys, these are the next steps. And it's through those diagnostic testing, and it's very specific what those tests are. The semen analysis, when we do the test to be able to check to see if a woman's tubes are blocked. We check their FSH level, which is their follicle stimulating hormone level, to see how hard their body is working to produce eggs every month or to release those eggs. We have very stringent protocols as to what we're testing. One of the things that we test for now that we have seen a huge success rate as well is the antibodies. So we test a woman's antibodies to see, and then there's 3 antibodies that we specifically test for to see if the body is going to attack that fetus. Because one of the things that we see is that some women, they get pregnant, but they're constantly miscarrying. And why is that? Well, we now know that there's a reason behind that in some cases, and there is an immune problem, but there is treatment for it. So we can definitely help those patients. But once you start with these specific tests, and that's why it's so important to have that consultation with our medical specialist, because some doctors send patients off on all these random tests, and you spend all this money, and there's absolutely no need to have spent half the money that they've spent when there are these specific ones that they want to do.
Thank you. Any parting messages as we close off this interview with regard to the service standards that people can, and that encompasses the medical and the customer relations and so forth, with regard to BFC?
Well, I would have to say that our staff and our quality of service, we really stand and believe what we do because we see it. We see patients coming in every day. We see them coming back in with their babies. And I think the greatest thing for patients to remember is to not give up hope, that there is hope when you are going through fertility. And there is hope out there with a clinic that really does have the best standards. I read this quote the other day that said, hope stands for having only positive expectations. And with Barbados Fertility Centre, you know that you're going to get that positive expectation. We're going to do every single thing that we can to give you, yourself, the very best chance that you can to get pregnant.